Hello friends and welcome to this 7th episode of Understanding Cataract, a complete guide. I hope my videos are adding value to you of understanding this disease of cataract with all my past episodes, which explained everything to do with signs, symptoms and management. Just a quick note about the format that I've been doing in this series of cataract. You know that I was interviewed by a famous YouTuber called Aparna Ganesh. So in this episode also, you will see a part of my interview, a little bit of interaction about this process of management of cataract. Now today's episode is all to do with intraocular lenses, their origin, what they really are, and their history. So friends, we've come a long way in understanding the disease of cataract. In my past episodes, I've discussed symptoms, signs, and management of cataract. So now it is time that we turn our attention to the intraocular lenses which get implanted once the cataract is removed. This is the most important step of cataract surgery. So in my past episodes, I've described several times that it can be said that cataract surgery is actually a lens replacement surgery. So we have to remove the natural lens from the human eye and then replace it by an artificial lens, and that's called the implant or the IOL. Sounds interesting, isn't it? So let's dive into this topic right away. Hello friends, I'm Dr. Kumar, doctor from Dr. Eye Institute, and this channel of iLogs is all to do with vision and eye care. If you haven't watched my previous episodes in this series of Understanding Cataract, a complete guide, please do so. I've shared the link in the description box below. If you haven't subscribed to my channel, please do so. And don't forget to click the bell icon so that you get notified every time I release a new video. So let's get started with my interview with Aparna Ganesh.
We commonly hear the term IOL, which is intraocular lens. Doctor, can you please help us understand a little more about that?
Intraocular lens is a lens that we place inside the eye in the same location where the cataract was removed from.
Okay.
So essentially, it's like a knee replacement. It's a lens replacement surgery.
Okay.
So you remove the lens, leave the support that's necessary, and put a lens inside the eye. And that's actually necessary to be able to see well. About 25 years back, there were no lenses. So
Okay,
that time, what used to happen is we used to remove the cataract, and those are the thick glasses that were given to the patients later on. They were also called soda glasses.
Right.
So the number then used to be plus 10, plus 13. And now all of that is going inside the eye. So friends, I hope this clears your doubt about what IOLs are. Let me show you a prototype for demonstration purposes. The center part, which measures 6 millimeters in size, okay, you heard me right, 6 millimeters, okay, is called the optic. And this actually focuses the light on the central part of your retina, which is called the macula, and so you can see well. The two arms on the side are called haptics. They actually are maintaining the position of the central part, which is the optic, right in the center. So the haptics also are a part of the lens, which plays an important role to maintain your lens right in the center. It is also called in the bag placement of the IOL. The lens, that is our IOL, is placed in the same place where the natural lens was, and that's called the cataract. So we remove the cataract, we maintain the posterior capsule, which is the support of the IOL, we maintain the side part of the lens, and so the artificial lens, which is the IOL, is placed inside the bag. And this is how the lens is centered, and this is how you can actually see after cataract surgery. So let me tell you a little bit of scientific facts about the size of this intraocular lens. The central round part, which is called the optic, measures 6 millimeters in size, and the two haptics, the overall diameter is between 11 to 13.5 millimeters. So different companies make different designs, and there are different types of IOLs in the market. But this is normally an average range that you will find. In my 5th episode, I spoke about the oldest technique called couching, which actually was removing the lens from its natural position, and this left the patients aphakic. Way back in the 60s, there were no IOLs. So what used to happen was we used to remove the cataract, and then give those thick soda glasses. So a patient would normally get a plus 10 number for distance, and you add 3 more, so a plus 13 or a plus 14 number for reading. Friends, IOL have a very interesting history and origin. So let me take you quickly through the history of IOLs, their origin, and to what we are today. To fully understand the current status of IOLs, it's important to take a step back in time, 60 years back, to understand where we are today. In 1949, Sir Harold Ridley, an English ophthalmologist, invented the IOL, working for the Royal Air Force. And he noticed during World War II, the pilots, when they were coming back and they had injuries in their eye, the windscreen of the plane which shattered and had actually penetrated the eye of the pilots. And he saw that this shattered plastic particles which were inside the eye gave no reaction. And because it gave no reaction, it also means it was inert. And then he thought that, okay, we are removing the cataract. Why not use this kind of a material inside the eye when the cataract is removed, and so that the patients can see? So that's really the history of invention of IOLs. He actually got this idea when one of his students asked him that, sir, you're removing a cataract, why not place an artificial lens at the same position and so that the patients can see? So Sir Harold Ridley performed his first surgery on a human eye in November 1949 in a 45-year-old lady who had cataract only in one eye. The lens that he implanted was made of PMMA, polymethyl methacrylate. It's a plastic which is known to be inert to the human eye. So the next milestone in IOL development was creation of a foldable IOL, and this was done in the 1950s. So the first foldable IOL of the 1950s was made of hydrogels. The next milestone was the invention of a silicone foldable IOL by Kaiser in 1978, and this was implanted in a human eye. From 1997, there is no looking back. There's huge inventions in different types of IOLs. The first foldable multifocal IOL which got FDA approval was in 1997. We have a variety of IOLs today: multifocal, extended depth of vision, toric. These all IOLs actually can aid our patients for better vision, for distance, intermediate and near. So today science is really advanced compared to the olden times, and we can give reasonably very good results with all this technology that is available for us. So friends, this brings me to the end of this episode where I've discussed the invention of IOL. The next episode I'm going to describe as to how one can actually select what is the best IOL for them. But for all of this, you have to stay tuned for my next episode. So friends, see you next Sunday. So friends, kindly save this WhatsApp number in case you have any query regarding eye care and vision. And please don't forget to send us a hi so that we also can save your number and you also get notified for all the new episodes that we are going to release in the future about eye care on this channel of iLogs.